Health status of the community. Introduction. According to the National Health Report 2015, around 55% of Indian women aged between 15 and 49 have anemia or low blood cell count. Over 38% of children in India have stunted growth. 18.6% children under 3 years have low birth weight, under 2.5 kilograms. Interstate comparison of female infant mortality rate, per 1,000 live births, for year 2017. What all these data shows. Definitions. Health. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. By WHO. Illness. Illness is defined as a sickness or disease, or to a period of sickness and disease. By Zegan's Medical Dictionary. Disease. A disorder of structure or function in a human, animal, or plant, especially one that produces specific symptoms or that affects a specific location and is not simply a direct result of physical injury. By Zegan's Medical Dictionary. Wellness. A conscious, self-directed, and evolving process of achieving full potential. By the National Wellness Institute. Illness-wellness continuum. Definition of a community. A social group of any size whose members reside in a specific locality, share government, and often have a common cultural and historical heritage. A group of people with a common characteristic or interest living together within a larger society. Health status of the community. A generic term referring to the health, good or poor, of a person, group, or population in a particular area, especially when compared to other areas or with national data. By Zegan's Medical Dictionary. Indicator. A parameter, or a value derived from parameters, which points to or provides information about or describes the state of a phenomenon or environment or area with a significance extending beyond that directly associated with a parameter value. By the Organization for Economic Cooperation and Development, OECD. Indicators simple to understand. Indicators of health are variables used for the assessment of community health. Characteristics of indicators. A should be valid, i.e., they should actually measure what they are supposed to measure. B should be reliable and objective, i.e., the answers should be the same if measured by different people in similar circumstances. C should be sensitive, i.e., they should be sensitive to changes in the situation concerned. D should be specific, i.e., they should reflect changes only in the situation concerned. E should be feasible, i.e., they should have the ability to obtain data needed, and F should be relevant, i.e., they should contribute to the understanding of the phenomenon of interest. Classification of indicators. Quantitative indicators. Qualitative indicators. Quantitative indicators. Quantitative indicators are those that measure quantity, usually as rate or ratio. For example, infant mortality rate. Birth rate is a quantitative indicator. Qualitative indicators. Qualitative indicators can be defined as people's judgment or perception about a subject. For example, perception towards HIV or AIDS affected person, or quality of life of elderly in a community. Hierarchy of indicators for a health. Input indicator. Process indicator. Output indicator. Outcome indicators. Impact indicators. Indicators of health status. Mortality indicators. Morbidity indicators. Disability rates. Nutritional status indicators. Healthcare delivery indicators. Utilization rates. Indicators of social and mental health. Environmental indicators. Socioeconomic indicators. Health policy indicators. Indicators of quality of life. Mortality indicators. Mortality rates. The traditional measures of health status. Widely used because of their ready availability. Death certificate is a legal requirement in many countries. Crude death rates. Specific death rates, age/disease. Expectation of life. Infant mortality rate. Maternal mortality rate. Proportionate mortality ratio. Case fatality rate. Mortality indicators. Crude death rate. The ratio of total deaths to total population in a specified community or area over a specified period of time. The death rate is often expressed as the number of deaths per 1,000 of the population per year. Also called fatality rate. Expectation of life. The number of years left in the life of the average person of a certain age, as determined by a mortality table. Maternal mortality rate. The death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. Infant mortality rate. Infant mortality rate, IMR, is the number of deaths of children less than 1 year of age per 1,000 live births. The rate for a given region is the number of children dying under 1 year of age, divided by the number of live births during the year, multiplied by 1,000. Child mortality rate. Child mortality, also known as under 5 mortality or child death, refers to the death of infants and children under the age of 5 or between the age of 1 month to 4 years depending on the definition. Disease-specific mortality. A total or crude mortality rate utilizes deaths from all causes, usually expressed as deaths per 1,000. A disease-specific mortality rate covers deaths due to only one disease and is often reported on the basis of 100,000 persons. The population base may be defined by gender, age, or other characteristics. Morbidity indicators. Morbidity rates. Data on morbidity are preferable, although often difficult to obtain. Incidence and prevalence. Notification rates. Attendance rates, outpatient clinics or health centers. Admission and discharge rates. Hospital stay duration rates. Morbidity indicators. Incidence. Incidence in epidemiology is a measure of the probability of occurrence of a given medical condition in a population within a specified period of time. Prevalence. It is arrived at by comparing the number of people found to have the condition with the total number of people studied, and is usually expressed as a fraction, as a percentage, or as the number of cases per 10,000 or 100,000 people. Disability indicator. Event type indicators. Number of days of restricted activity. Bed disability days. Work loss days within a specified period. Person type indicators. Limitation of mobility. Limitation of activity, ADL. Expectation of life free of disability. Healthy life expectancy, HALE. HALE is defined as average number of years that a person can expect to live in full health, by taking into account years lived in less than full health due to disease and/or injury. The disability adjusted life year, daily. Number of years lost due to ill health, disability or ill health. Quality adjusted life year, QALY. QALY measures years of survival weighted for the quality of life, which people may be expected to have in the context of different states of illness. Number of years of life that would be added by a medical intervention. Years of life lost, YLL, percentage of total. YLL are calculated from the number of deaths multiplied by a standard life expectancy at the age at which death occurs. Nutritional indicators. Nutritional status indicators. It is an indicator of positive health. Anthropometrics measurements. Height of children at school entry. Prevalence of low birth weight. Clinical surveys, anemia, hypothyroidism, night blindness. Healthcare delivery indicators. Healthcare delivery indicators reflect the equity/provision of healthcare. Doctor/population ratio. Doctor/nurse ratio. Population/bed ratio. Population/per health center. Utilization indicators. Healthcare utilization rates. Extent of use of health services. Proportion of people in need of service who actually receive it in a given period. Proportion of infants who are fully immunized in the first year of life, i.e., immunization coverage. Proportion of pregnant women who receive ANC. Hospital beds occupancy rate. Hospital beds turnover ratio. Social/mental health indicators. Indicators of social and mental health. Valid positive indicators do not often exist. Indirect measures are commonly used. Suicide and homicide rates. Road traffic accidents. Alcohol and drug abuse. Environmental indicators. Environmental health indicators reflect the quality of environment. Measures of pollution. The proportion of people having access to safe water and sanitation facilities. Vectors density. Socioeconomic indicators. Socioeconomic indicators is not a direct measure of health status. For interpretation of healthcare indicators. Rate of population increase. Per capita GNP. Level of unemployment. Literacy rates, females. Family size. Housing condition e.g., number of persons per room. Health policy indicators. Health policy indicators. Allocation of adequate resources. Proportion of GNP spent on health services. Proportion of GNP spent on health-related activities. Proportion of total health resources devoted to primary health care. Other health indicators. Indicators of quality of life. Basic needs indicators. Health for all indicators. Basic indicators. Under 5 mortality rate, U5MR, 2020 32.6. U5MR by sex 2020, female 33. Infant mortality rate, under 1, 2020 27. Total population, 2021 1,407,563,842. Life expectancy at birth, years, 2020 70. Please like, subscribe and click the bell icon. Thank you for watching video.